Hi there, my name is Dr. Trent Davidson and I'm one of the dentists here at Mindset Dental. I remove a lot of difficult wisdom teeth and a lot of teeth in general. And today I wanted to talk about what to expect when you're having a tooth removed and also how to make sure everything heals well afterwards. So firstly, if you decide to have a tooth removed while you are awake, the first thing we like to do is we like to make sure that area is very, very numb so you won't feel any pain. And to do that, there will be a couple of needles, but often we use a bit of numbing gel just to make everything feel a little bit more comfortable for you. Once things are numb, what it's going to feel like is it's almost going to feel like the area where that tooth is going to feel 10 times bigger. You're not going to look any different, it's just going to feel like it's quite swollen for a couple of hours. And that's a good feeling, that's what we want you to feel. Before we do remove a tooth, we'll make sure it's 100% numb. And when we do that, I can make sure that you're not going to feel any pain whatsoever. But what I can't numb up is pressure. And so it's a very strange feeling having a tooth removed while you are awake. You'll almost feel like the tooth's been removed, but you won't feel that it hurts. And that's a normal part of having a tooth removed. Now, throughout all these procedures, just like we always do here at Mindset Dental, you're in control. If you feel like you would like a break at any point, you can always raise your hand, and I'll explain the process to you kind of as we're going. Not every nitty-gritty detail unless you would like that, but I really would like you to know what to expect to feel, especially before you actually feel it, just so there's no surprises. Now afterwards, there's going to be a little space where that tooth was. That's going to fill with blood and form a blood clot, and that blood clot's the basis of the healing. So if that blood clot stays there, everything will heal well, it won't be sore for too long, everything will be great. If that blood clot falls out, we get something called dry socket, and it's painful, it takes longer to heal, and so we want to prevent that if possible. The best way to prevent it is by following 3 rules. The first rule is I don't want you to eat or drink anything for the first 4 hours. So make sure before you come in on the day of the tooth removal, you do have some food, have some water. I don't want you to starve. The second most important rule is no alcohol for 24 hours. And the third rule is no smoking for 24 hours. Most complications that we do get after we remove teeth are generally when people are smoking. If you follow those 3 rules, generally things will be pretty good. As far as pain goes, when you leave here on the day of the tooth removal, it's not going to be sore because you're going to be a bit numb. When the numbing wears off, it will be sore. It will be sore that day, the next day, probably the day after, but it will get better day by day. Sometimes it can even take a week or 2 to fully feel like it's normal again. But you should be able to get on with most of your normal activities after a few days. As far as pain relief goes, generally Nurofen is your best bet. Sometimes people can't take Nurofen, and that's where Panadol is another good option. But if you can take Nurofen, taking Panadol and Nurofen together is often the best thing you can do once the tooth is removed. As far as bleeding goes, when you leave here today or when you leave here on the day, I'm going to make sure that that blood clot is fully formed. I'm going to make sure it's not bleeding at all, but it will ooze a bit for 24 hours or so. What I mean by ooze is it's not going to be bleeding much, but you might be able to taste something a little bit metallic because the area is right next to your tongue, or your saliva might be a tiny bit pink, but it will be 99% saliva, 1% blood. So try not to worry about it too much. You can just swallow the saliva or gently spit it out. If you are worried about the bleeding, I'm going to give you some of these little bits of sterile gauze. And what I want you to do with this is grab one of them, bite on it nice and hard where we remove the tooth, and that pressure of biting for about 10 minutes will stop any last of the bleeding. And we'll give you a lot of that to take home. Now I've just told you a few instructions just to make sure everything's going okay, or will go okay. These here are some instructions. You can, pretty much everything I've just said, you can go home, have a read of that afterwards. But if you only remember one thing, just don't eat or drink for 4 hours once the tooth is removed.